Faces of CRPS is a docu-series presenting real people with CRPS, complex regional pain syndrome, also known as RSD, reflexive sympathetic dystrophy, and causalgia. These conversations are graphic and largely unedited, their purpose being to allow a glimpse into life with CRPS, the most painful condition on the McGill Pain Scale. Each interview is unique and showcases one or two experiences in hopes that lawmakers, physicians, health educators, families, and friends will understand it and see the effect that medical gaslighting and the laws surrounding opioids are having on pain patients. We hope our stories inspire and educate you about this horrid disease. Trigger warning. Graphic pictures and language, talk of self-harm, and explicit descriptions. Good morning,
Good morning.
or actually afternoon, isn't it? It's
It's
afternoon. All right. So, Lauren, when did you how did you get CRPS? And then how long did it take you to get diagnosed with CRPS?
okay. So I had a car wreck, April 2nd, 2019. They didn't know it was wrong. It's a long story, but they didn't know it was wrong. It turns out they sewed me up and they left a piece of metal in my femur. Um, no one believed me for the longest time. I got called a drug seeker. Went from doctor to doctor. Finally got it out. Had bone and cartilage taken out. Got to a doctor that believed me. And then something was still wrong. I was like, why am I having this cold burning? This is the worst pain I ever felt. I can't walk. I can't, can't think and can't do nothing. Um, and then I got to a neurologist, and the neurologist saw me walk. And then I got to my doctor now, who saved my life. It took 292 days to get diagnosed. And each day was just dragging on. So,
Wow. Wow. And that I would the amount of medical gaslighting that is going on just is that's one of the reasons why we're doing this series is to highlight the medical gaslighting that happens, and it is just have no idea the torture that they put us through
yeah,
by delaying diagnosis and calling us drug seeking, and it's all in our head. Or for me, they tell me, oh, you're just old,
yeah,
just it's ridiculous.
it is.
And we laugh about it because we have to laugh about, you have to keep your sense of humor or you wouldn't make it through this thing. But
Yes.
it's not funny at all. Like, it's not. um, the stories that, it's just ridiculous. So
Yes.
did you say 292? Sorry.
202 days. I counted them day by day,
Wow.
just through it. And they wouldn't give me crutches or anything. They wanted me to walk on it, on a piece of metal in my femur. And I had to crawl up the steps. My mom and everyone had to help me get up the steps because I had no mobility device to use because they wouldn't let me use one because they didn't believe me.
Oh my goodness. That's just insane. Insane. So you finally found these doctors. My story, I have a doctor that saved my life. So I get how you feel about these guys, or maybe it's ladies, I don't know, but you finally found a doctor that realized what was going on, and what have they been able to do for you, honey?
Um, we've tried the nerve blocks. For some reason, the one in my neck, it helps, but every time I get it in my back, so we stopped doing it in my back. I've tried Lyrica, I've tried all kind of medicines. Opioids have been the only thing to really help besides ketamine. Um, and I'm trying ketamine and it's helping a lot. So before the meds wouldn't even touch it, but I was glad to have them have something, some kind of treatment that helped.
Right.
So
Okay, so you're doing ketamine infusions, or do you do the nasal spray or the troches, or what?
I'm lucky enough to be able to get the IVs. I know it's not
Mhm.
affordable for everyone and not everyone has access to it. So I do the IV.
That's wonderful. And that's really helping.
Yes,
How
ma'am.
often do you have to do that?
Um, this is my sixth infusion. I guess you do like a series and then you
Hmm.
every 2 to 3 months, but he's probably gonna have to do more because I still have my legs. I don't have my arm though no more. I can move my
Oh my
hands.
God. Praise
Y-
God. I mean, that's incredible. Yay.
Yes.
Yeah. So you
Yes.
had it, tell me the places that you had it and like
I had it elbow, like all the way up to like my what is this?
shoulder.
My shoulder. Sorry. Pain
No,
brain.
that's okay.
And then I have it at my ankle and I have it like hit down in my right leg.
Okay. So was it like that from the beginning, or did it start in one spot and then spread out?
It started one spot and spread out over time.
Hmm. That's how it does. Where did yours initially start?
My right leg.
Mm.
My right like where they left the stuff in me.
Mm. Now, um, Lyrica brain, sorry.
You're
That I can't live without it. Like
yeah.
I'm not complaining
Yeah.
at all. Um, Before you said it went to your arm, did you have any kind of interventions in that arm that might have, because a lot of the interventions for CRPS are invasive. So they, like you mentioned, they do nerve blocks and they do spinal cord stimulators and they do pain pumps and they do uh, all kinds of invasive things. And the problem with CRPS is that if you have something invasive, it can make it spread to that area. So did you have an IV in that arm or any kind of thing that
I
might have caused it to spread?
I think me having the nerve blocks. I think
Mm.
over but I think that's what kind of helped my arm get better, the nerve blocks and ketamine. But in my back,
Hmm.
my doctor knows that I can't do it with my leg because it flares it up. But my arm, it was worth trying, and it, you know, helped it.
Oh, I'm so glad, honey, because
I'm so
right now
very
mine is in my foot and sometimes it mirrors to my other one, but um, I don't have it in my hands, and I'm so grateful for that because I mean, you just use your hands for everything.
it was
I
a
feel so
claw.
bad.
It was a claw. My mom, like, she would never say this to another person, and she got my permission, but she used to call me her T-Rex because my hand would like be like that, and I couldn't use it. And she said, "There you go,
Oh,
getting stuff done, even with your T-Rex hand." So
and you find ways
yes,
to, I mean, you have to live. We have to live with this thing. And so you find ways around
yeah,
things. But
yeah,
I'm so glad I'm so glad.
yeah.
Ketamine seems to be helping a lot of people that I'm talking to, and I haven't tried it yet.
It's
I'm kind
very
of, I'm scared of the needle sticks.
yeah,
And I don't think I would mind some of the things that people report, hallucinations and things like that. I'm not afraid of it from that aspect, but it's just actually the needle stick worries me. So
yeah.
I don't want, maybe I could have them put the ivy in my foot.
Or I know some people get like a port, and it helps. So
Yeah, that's a good idea, I think. Although I'd hate to have it spread to my heart, because
yeah,
a lot of those are central or pretty close to
I
the heart. So,
I didn't know it could do that.
mm,
That's
it
scary.
could. Yeah. I mean, any place that catheter would go inside that could cause an irritation. I mean, that's just, I was a
Yeah,
nurse
yeah,
for my career, and that to me, that I haven't read that anywhere. Nobody's told me that. That's just my
yeah,
speculation that it's possible that since you're running a line through, it could make it spread just because of setting off that inflammation. But this thing is just so hard to live with, and to finally find somebody that believed you
Yeah.
is I mean, my heart just, because to not be believed, to have something so severe that affects every part of your life, and to have people look at you and not believe you, or I've even just been accused of making it up to get attention. Like they literally accused me of lying, and it's as a nurse, it really bothers me that people are being treated this way. And it's not just with this condition, it's with other chronic pain conditions. But so tell me the difference between your life before CRPS and now with CRPS.
Before I was not scared for my future. Um, my anxiety and stuff was a lot better too, and I was able to do more. I was able to keep a full-time job. Um, I was able to wear shoes. Shoes are a no-go for me. um, the wind didn't hurt. Just I was able to do more. I didn't feel like I had to crawl through the day. So
Yeah, yeah. It really it makes an impact on your life that is so you can't even really describe it. Um, have you how do you sleep? Are you able to sleep?
um a lot better since the ketamine, but some
Good.
nights up at like 3 or 4 in the morning. I don't know why it's always bad at night, but
Mm,
some nights I can sleep, some nights I can. So
mm-hmm. Yeah. And that really affects your pain too, or at least it does mine. Now, are these ketamine treatments, is this out of pocket for you?
it is,
It
but I'm
is, yeah. Most of them are. I don't
yeah,
know why insurances aren't covering this for us because it really, so many people, or maybe, or even covering going to the Sparrow Clinic or something, because we know that there are treatments out there,
yeah,
scrambler therapy. Have you had scrambler?
I haven't. I haven't really been
Oh,
able to afford. The only reason I'm able
yeah.
to get ketamine is because my doctor's only doing it for like $400 a session.
Oh,
So
wow.
I'm
Yeah,
very,
that's awesome.
very blessed.
Yes, yes. Um, yeah, so this is another huge issue is that there are therapies out there that work. We just mentioned them, Sparrow Clinic, Scrambler therapy, ketamine infusions. Every one of them is out of pocket. And I know Sparrow Clinic is like, I don't know, like 50,000, maybe even more than that,
Yeah.
which is a lot of money. And Scrambler's much more affordable. They're just coming out with some machines that are scrambler-ish like that you can buy and have in your home. And I think we've got somebody in the group trying that out, so we'll have some feedback maybe because it's I think a couple $1,000s or something. I mean, it's doable as opposed to 50,000 or whatever scrambler therapy's costing. All right, let's see. See, this is the part I edit out.
I know. I always get awkward with people sometimes because, like, I don't know how to talk to people. I spent so much time in my home that I don't really get to
Mm-hmm.
talk. So,
Yeah, exactly. You forget how to interact with people, or I do. Let's see. Do you, so you can't wear shoes. I have one pair of shoes that I can wear, and that's it. And they're like a knockoff of Uggs. They're all
yeah,
sheepskin on the inside, and I have to have, it's like a size bigger than what I would normally wear. And that's what I wear, winter, summer, doesn't matter what I'm wearing. Like, I don't care what I look like at all.
because my feet are
I'm
always
comfortable. Yeah, yeah. So you've had it how long now?
um
CRPS. You should tell me.
1,701 days.
Oh my gosh, you counted in days. God bless you.
You just have to crawl through each day just to.
You do. It is a day by day. Absolutely. Now, so are you able to walk?
Um, with opioids, I am, um,
Okay.
and with ketamine. So
Very good. Very good. And so let's talk about that because right now there's some craziness going on up in
yes,
Maine, and they're trying to like outlaw opioids altogether.
and
Like they can't.
they can't give us a cure. It's like saying, okay, let's shame. They wouldn't shame cancer patients for getting chemo. Opioids are just a treatment.
Exactly.
Give us more affordable treatments. Give us a cure. You know, no one wants to be on opioids. So
Exactly. Yeah. I think they're really, I mean, I understand what they're doing. They're trying to control things, but
yeah,
they can't make us suffer for that. Now,
yeah,
I don't take opioids yet.
yeah,
Right now, the Lyrica is helping me, but I want to know that they're there for my future if I
yeah,
need them, and for people like you that are on them and depend on them to be
yes,
functional,
yes. Because like I
to,
had to do my makeup today, and I don't usually get to do that. You know,
yes, yes. And well, without them, what would your life be like if they took them away from you, which they're doing to people? They're just taking them away from them. What would your life be like without them?
I don't think I'd be here. I don't think I'd be alive. I wouldn't want to suffer. Um, before I got on them, I couldn't leave the bed. I couldn't feed myself. My mom had to bathe me, and it would make my family's life even harder. You know, they don't think about that. They don't think of how it affects your family.
Exactly. Yeah. They're confusing us with drug addicts. There's a
Yeah,
huge difference. And I don't have anything against drug addicts. I mean, I understand that whole process too.
yeah.
But
But even they feel pain. Even they
of
feel pain.
course
They
they do.
suffer. You know, I love a person that has a SUD, and if they were ever in a wreck, I would want them to have pain management too. You know,
Exactly.
um, the person told me just because I have a substance use disorder and I've used the drugs does not mean that y'all should suffer. So, and it's not helping them. It's not
No,
helping.
no, no, I can't, especially, having been a nurse and being a strong patient advocate, I just can't understand. They used to, I worked with premature babies in intensive care. So at one time when I first started nursing, which was a long time ago, um, they didn't give babies pain medicine because they didn't believe they felt pain. I mean, it sounds unbelievable, but that's how it was when I started nursing. Like to think that a baby doesn't feel pain is just,
Yeah,
and to not treat people's pain is unconscionable. I mean, it's just, I don't understand how they can let people suffer. And like you
yeah,
said, we're not going to suffer because we're just not going to live in that kind of pain. This is not the kind of pain that you just live with. It's,
yeah,
if you don't have something to help you through it, you don't get through it. And
yeah,
that's why it's called the suicide disease. And I haven't talked to one person. I haven't interviewed one person with CRPS that hasn't thought about it. And sometimes even daily, like, and it's not that any of us don't want to live at
yeah,
all. Like we all want to live. It's just that people just don't understand how severe this pain is. That's all. They just don't. If they did, if they have it for a minute or 2 minutes, they would say, give them anything they want. you know, they would understand.
give me
But
one. Sorry, my nose was running. I
yeah,
was
that's
getting away.
okay. Oh, that's okay. Um, it's unbelievable. Unbelievable. And you have to be careful, or at least I feel like you have to be careful when you go to the doctor when they ask you all the depression questions and stuff. You have to be careful what you say, or you wind up getting locked up somewhere, you know. And I'll edit that part out, but
Yeah.
that's the way it is.
Yeah.
So, now you got gaslit by doctors, obviously.
Yes.
Did you get gaslit by any family or friends, or have they been pretty understanding? Sounds like your family's very supportive.
I am very lucky. I know a lot of people that have. I am very lucky to have this support system I do.
Good.
Very lucky.
Yeah. Makes a huge difference. Some people just don't have anybody to rely on. They don't have any kids or any family, or their family has walked away from them. Um, because a lot of times that's because the doctors have gaslit the patient in front of the family. That actually happened to me. And my family believed the doctor rather than me.
I'm so sorry.
And that was that was not good. My son actually now has he's my emergency medical person rather than my parents because I won't trust him anymore because they would believe the doctor. But I can't blame them for, their generation. You did think the doctors were like God, you know. So
And they're only practicing medicine.
I know. And they don't learn about all of these conditions in medical school. I have another condition that they didn't know about either, and they gaslit me for 5 years, and it was something I needed surgery for. So I understand when you talk about having this thing that obviously needs to be operated on, and they're just blowing you off, and you have to somehow get through that time until God brings you some amazing surgeon that immediately knows what's wrong with you and gives you hope. And it changes everything to get that out of there. And did your surgery help a lot?
Um, it helped. My knee still sometimes dislocates and sometimes I have to like pop it back in. But
Hmm.
it helped a lot with the pain. But the burning and the drilling and stuff, like I was wondering why I still had that. And it's the CRPS.
Yeah. Okay. And so you haven't had a spinal cord stimulator.
I've had the trial, but
Mm,
it kept spreading up to my neck, and my doctor thought it was too risky to put it in.
hmm.
So,
Okay. And do you do a lot of physical therapies or anything like that?
um, I have a lot of doctor's appointments, so I have a hard time getting that in. So, hold on, give me 1 second. So I try to walk when I can. Like I do, like maybe a half a mile once a week if
Hmm.
I can. Uh,
Hmm.
and like I like the pool,
Hmm.
the pool. Sometimes like I'll have it like heated up and it'll help some.
Yeah.
So
Good. Yeah, what my doctor told me in the beginning when I got my diagnosis, use it or lose it.
yes,
Come back to me when you're ready to amputate it.
yeah,
That was his whole spiel.
yeah,
So I took him pretty seriously and, I use it. But you have to have enough pain control to do that. That's the whole that's the whole thing. And that's what they don't understand. We have to have a certain amount of pain control just to get out of bed,
yeah,
just to brush our teeth. We have to have a certain amount of pain control to be able to brush our teeth, brush our hair, braid our hair, whatever, put your makeup on. That takes energy.
yeah,
People don't understand the amount of, how we have to. Pain is a huge energy draw. You can imagine, like the Energizer Bunny, he can only go so long and then his battery runs out. That's kind of how we do. The pain just saps our energy. And so we're constantly having to, or at least I am, uh, not do, really pace ourselves, I guess. Obviously, you've had to learn how to pace yourself
yeah.
when you're trying to do things. And It's way different than before CRPS. CRPS, I was the Energizer Bunny before it. All right. So, do you have any like comorbidities? Have you had other things happen because of the CRPS?
I'm not sure if it's because of the CRPS, but my blood pressure and just I've gained a lot of weight, and I haven't really been able to get it off because I haven't really been able to get out and exercise, and being overweight it's not healthy. Not that I don't look good, but like it's not healthy for my health. So a lot of it, like my blood pressure. So
Hmm. Yes. I also have blood pressure problems, and I think it is definitely related to the CRPS because I didn't have them before. Obviously, when you're in a lot of pain, it makes your blood pressure go up. But even when I'm not in a flare, even when I'm not in tremendous pain, my blood pressure is still elevated. And I think that's just the central nervous system being ramped up constantly. Just, obviously the CRPS. I don't want to go back. We talked about, how it's affected your life and your family's life. You said your mama had to feed you and bathe you and take care of you, which I'm sure it's been hard on them. And I'm
yeah,
sure they're putting up a strong face, families do, but um, it's not something that you expect
yeah,
for your parents to have to be caring for you. And you think it should be the other way around, you know.
yeah.
Yeah,
And I only have my mom because my dad died. He was in the Navy, and he ended up having like some alcohol issues, and so
yeah, probably PTSD.
yeah, he did
Yeah.
like the welding, like the sealed underwater welding or whatever.
Oh,
So
wow. Yeah. Yeah, so I'm sure he had some PTSD. My dad's a Marine, and he
okay,
does. And let's talk a little bit about medical PTSD.
yeah,
Do you feel like well, you have good doctors now, so it's not as big of an issue, but if you had to go to a doctor that you didn't know for the first time tomorrow, would it be an issue? Do you feel
yeah.
like you have medical PTSD?
Yes, like my blood pressure, I'm supposed to go see about it, but I'm too scared to go because I'm gonna be like, I'm scared they're gonna be like, why are you on opioids? It's because I don't have any other treatments that are really helping besides the ketamine. And just always thinking they're gonna think bad about me because of the medication I'm on, or because they don't really know much about CRPS or
Exactly. Yeah. Yeah. It makes it. You shouldn't be afraid to see a doctor. You
yeah,
shouldn't be afraid to go to the emergency room. Everyone that I have interviewed and talked to with CRPS is petrified if they have to go to a new doctor
yeah,
or go into the ER because of the way you get treated.
yeah,
And it's not just opioids. I mean, I'm only on Lyrica, and they look at me the same way.
yeah,
And I don't understand it. And it is, this is why we're doing this series. It is a lack of knowledge.
yeah,
It is a lack of knowledge on their part. But the problem is they try to pretend like they know more than we do. We're the ones living with it every day. Like we are the experts
yeah,
on it, really. And they won't admit that it's something that they don't know. They won't even, or at least none of mine even offered to help me find somebody. If they would have just said, I don't know what's going on with you. I don't know what CRPS is, but let's get you to somebody that does and do a referral or, some kind of help.
yeah,
But instead, they turn into the adversary.
yeah,
I'm gonna make t-shirts that says, Stop gaslighting. Stop medical gaslighting. Like, be an advocate, not an adversary, or something like that.
I am
You're working
terrified.
on it. Yeah, because
Terrified
we
for
are. If you cut yourself and you knew how to suture yourself, you'd probably do that before you go to the ER, wouldn't you?
yeah, yeah,
Yeah, I would too. I would too. That would be better than even without lidocaine or something. That would be better than having to go in and deal with the way you get treated.
yeah,
And this law that where they're trying to outlaw opioids, people besides us really need to pay attention to that because that's going to include them when
yeah,
they get in that automobile accident or when they have to have that hernia surgery, that they don't get it either. Or, you know, the cancer patients that
yeah,
are on hospice that are just trying to get to their death in a
yeah.
painless way as possible. They're taking it away from them too. Like, this is a huge issue, huge issue. And I don't even know how it's gotten as far as it has. I didn't realize till we started doing this series that it's been going on for years. Like, I had really, because I'm not on them, I guess, I hadn't
Yeah.
realized that they've been trying to do this for multiple years now. So they've made headway, and but we really have to stop it. I'm hoping we can get enough. Uh, I mean, I won't send them the whole thing to watch, but I'd like to just cut clips, make shorts out of some of the videos that we're doing and send to Congress or the whoever that committee is that's making these decisions. Just start flooding them with clips from people of what the impact of what they're doing is having on our life. And even if you're in a state where right now things are cool and they're not bugging you, if Maine does what they're trying to do, they're going to try to push other states into it. And there will be states that follow. And I hate to say it, but it'll probably be more based on some kind of political shit than anything. But if they do that, like just the knowledge of knowing that they're working on it and it could affect us, just that is enough to ramp us up and make our blood pressure even higher. And like just the knowledge of that affects us even before they're even taking them away. I mean, because we rely on them on these medications, and I don't know.
They're lucky enough to be able to take a Tylenol and it help their pain. You know, they don't, they see it from a side, oh, I get to take Tylenol or I get to take this and it helps my pain, but you may need it one day. You know, why take away a treatment? You know,
Yeah, I don't understand when the power went from the physician to the pharmacy to the insurance companies. Have you had problems with your insurance company paying for doctor's visits and things?
I'm very lucky to have good insurance, but I guess ketamine, but I'm very lucky to have good insurance. I have Tricare, so
Oh, yeah, that is good then. Yeah. All right. Um, we've actually covered a lot of these questions, just going through it. So, what would you say to a doctor or family member that is, you know, doesn't understand CRPS? What would your advice to them be?
That is a hell disease. Excuse my language. I'm not cursing. I'm using hell as like a place. If a disease was a place, it would be hell. Um, if you don't know what you're doing, that's okay. Just don't gaslight us. Um, it's okay to not know everything, but
Yeah.
send us to someone that may. And for the family members, the person that's dealing with this is dealing with it a very, very, very hard thing, you know, and they need you right now.
Yeah, exactly. Do you have a service dog or have you ever thought of getting one?
I don't have a service dog, but I have an emotional support dog. My dog's a little bit too rambunctious. She won't let anyone, she does know when I'm having flares, and she'll kind of like do circles so that way no one will touch my leg.
Good,
So,
good. That's wonderful to have a companion like that. My mom has a service dog and well, she's retired now, but she had several. And so uh, they really make a huge difference in your life.
yes,
And even if it's not a service dog, just a pet, I think makes a huge difference because they know. They
that it,
my girl, I had a wolf hybrid and she used to lay with her back against my back to like and just snuggle back into me so that I could relax against her. She was amazing. I had to have her put down a few years ago, but she had a good life. She was 15. All right, let's see. Are there any other questions you want me to ask or anything else you want to cover?
not that I know of, not that I know of.
I think we got enough good footage. I don't know how long we've been going. Oh, only 40 minutes. We're doing good. I have like 3 hour recordings and then they'll come back and do another hour. And of course, we're trying to get them down into something, a length where people will actually. What is your input on that? How long do you think these sessions should be? What do you think people would watch?
I have really bad untreated ADD because I had to choose between my meds and ADD meds. So anything over like 45 minutes, like my brain just doesn't.
Hmm. Hmm. Yeah. Um, I mean, some of these stories are so long that it's really hard to, you know, there's things I go into edit and I'm like, oh my gosh, I need to shorten this video, but everything that they're saying is so on point, So, um, but I agree. I think it's going to have to be something like that. People are used to shorts now. I mean, they don't want to watch anything over 30 seconds.
Sorry, I had a zappy. That's what I call it.
Oh,
If you get the
yeah,
zap.
that's okay. Sometimes I just yell and I'm from the South and I was raised that, cussing was not
Yes.
good. And so I didn't. There was a time in my life I didn't cuss at all. Then there came a time in my life I actually taught myself how to cuss. Like I said, I'm going to liberate myself. I taught myself. And now I cuss way too much. And when I get those zingers like that, sometimes I'll just say,
Yeah. Yeah.
I mean, it's like automatic. I can't even hold it in. It's not even because they're just so intense. And I try not to do it with my grandma because I actually live in a house with my mom, my dad, and my grandma. And she's 90, she'll be 93 next week. So I try
Oh,
not to let the F bomb fly.
yeah. Sometimes it just comes out, but
Oh, I bite my lip. I mean, literally, that's not just something I'm saying. I literally like will bleed my lip, biting down, trying not to, oh, because they'll get you. And sometimes they don't go away.
yeah.
Like the other day, I was on my way to the doctor and I put the truck in gear and just doing that, just automatic, just doing that thing. I got one of those zingers in my hand
Ooh.
and like I still had it 20 minutes later at the doctor's office. And so I hope it's not spreading to my hand. I think it's just, I've always had full body neuropathy because I have had spinal issues from birth. But all
All
right.
right.
Thank you so much, honey. It's been a pleasure.
I hope you have a low pain day.
Thank you. You too.
Bye.
Bye. You may not have pain now, but imagine being in an accident or needing an operation and being denied adequate pain medication. Please make your voice heard. If you have CRPS, find a forum with people who truly understand. If you are considering self-harm, please call 988. What is one more conversation? Faces of CRPS, all rights reserved, 2024. A huge thank you to everyone who participated in the making of this docu-series. You and your stories matter. Envisioned and directed by Troy Thane. For more information, contact Troy at thane.com. Narration by Katherine Clements.